Round of applause as he comes to the stage.
The AU and Africa CDC leadership here present, representatives from the Kofi Annan Foundation, distinguished guests, faculty and partners, graduating fellows, ladies and gentlemen, I bring you greetings from the African Field Epidemiology Network, AFENET. Today, we gather not merely to celebrate a graduation. We gather to celebrate a strategic investment in Africa's future. We gather to celebrate a vision championed by one of Africa's greatest sons, Kofi Annan, who understood that the destiny of nations is ultimately shaped by the quality of their leadership. Africa's future will not be written by circumstances. It will be written by leaders. And today, we celebrate those who have chosen to lead. At a time when our continent faces emerging epidemics, climate-related health threats, misinformation, resource constraint, and growing demand on health systems, Africa's greatest need is not merely more technology, it's not merely more infrastructure, and it's not merely more funding. Africa needs leaders. Leaders who can inspire confidence. Leaders who can transform data into action. Leaders who can unite diverse stakeholders behind a common purpose. Leaders who can see beyond today's emergency and build tomorrow's resilience. That is why the Kofi Annan Fellowship in the Global Health Leadership Program is so important. It is not simply a training program. It is an investment in the intellectual capital, strategic vision, and moral courage that Africa needs to secure its future. Ladies and gentlemen, the history of public health teaches us a profound lesson. Major transformations are driven by leaders. It was leadership that eradicated smallpox. It was leadership that transformed HIV from a death sentence into a manageable condition. It was leadership that mobilized nations during the COVID-19 pandemic. It was leadership that brought the Mpox pandemic under control. And it would be leadership that determines whether Africa achieves health sovereignty, universal health coverage, and the aspirations of Agenda 2063. The future of Africa's health security will be determined by the quality of decisions made by health leaders across the continent. That is why I congratulate the AU and Africa CDC, the faculty, and all the partners of the Kofi Annan Fellowship in Global Health Leadership Program for the foresight and for the commitment towards building the leadership that is needed to transform our health sector. To the graduates, congratulations. Congratulations for going through all of it and for coming this far. You deserve a big round of applause. Now, much has been invested in you, and as is often said, to whom much is given, much is expected. Your best appreciation for the heavy investment made in you is to let your leadership produce transformative health dividends for your countries and for Africa. You are graduating into responsibility. The responsibility for shaping Africa's future rests with leaders such as yourselves. Kofi Annan once observed, and I quote, "More than ever before in human history, we share a common destiny. We can master it only if we face it together," unquote. That statement has never been more relevant. No country can achieve health security alone. No institution can achieve health security alone. No leader can achieve health security alone. The future belongs to those who can build partnership, foster trust, mobilize collective action, and unite people around a common purpose. Leadership today is less about authority and more about influence. Less about position and more about service. Less about titles and more about impact. Therefore, I challenge our graduating fellows with 5 commitments. 1, lead with integrity. Your qualifications may open doors. Your intelligence may earn you respect. But your integrity will determine your legacy. In public health, trust is our most valuable currency. Once lost, it is difficult to regain. So guard it very fiercely. 2, lead with courage. As leaders, you will face difficult choices. You will sometimes stand alone. You will sometimes be required to speak truth when silence appears safer. Whatever the case may be, always remember that the future belongs to those with the courage to act when action is required. 3, lead with compassion. Behind every statistic is a human being. Behind every mortality rate is a family. Behind every epidemic curve is a community. Never allow numbers to make you forget people. Number 4, lead with innovation. The challenges before us today cannot be solved using yesterday's approaches. Africa must harness data, digital technologies, artificial intelligence, genomic surveillance, and local innovations to accelerate progress. The next breakthrough in global health may, or should I say, should emerge from this continent. Number 5, lead with purpose. Leadership without purpose creates activity. Leadership with purpose creates transformation. Never forget the communities you serve. Ladies and gentlemen, the journey towards Africa health sovereignty has begun. Africa CDC has articulated a bold vision. Governments across the continent are strengthening national health systems. Investments are being made in workforce development, surveillance systems, local manufacturing, emergency preparedness, innovative financing, and research. Yet, significant work remains to be done. The next decade will demand leaders capable of navigating shrinking resources, emerging threats, demographic changes, climate shocks, and geopolitical uncertainties. You represent one of Africa's greatest assets in meeting these challenges. You are architects of Africa's future. On behalf of the African Field Epidemiology Network, AFENET, I wish to reaffirm our unwavering commitment to supporting Africa CDC governments and to working with all partners towards achieving health sovereignty and health security. I want to end with a story that is told in several versions. And this version I'm going to tell you is about an old man who was so knowledgeable and so wise that any question he was asked, he had an answer to it. So he went about bragging and boasting that if there was anyone who could ask him a question to which he had no answer, he was willing to be the slave of that person. Of course, everybody wanted to be the master of this wise, intelligent old man. So they asked him questions from archaeology to zoology, and he answered all. And there was this young man wanted to own this old man, this wise, knowledgeable old man, as his slave. So he thought about it carefully, went and caught a butterfly and put it in his palm and went to the old man. Now his intention was that you all know butterfly is very fragile. A live one in his hand, if he presses small, it was going to be a dead one. So he asked the old man, the butterfly in my hand, is it alive or is it dead? His intention was that if he said it was alive, with a gentle quiz, he would release the dead one. If he said it was dead, he released a live one. So he knew he was sure to get this old man. So he kept asking, the butterfly in my hand, is it alive or dead? This old wise man pondered over it for a long time and told him, the answer to your question is in your palm. Now you've gone through this excellent training. You've gotten knowledge, you've gotten skills, you've gotten leadership qualities. What are you going to do with all this? Is it going to be business as usual? Or it is going to be something different? Is it going to be transformation in our health sector? Or is it going to be business as usual? The answer to that question is in your palm. Thank you very much.
Another round of applause, ladies and gentlemen, for Dr. Simon and Antara. And a word on AFENET. The logistical delivery of the fellowship program over the last 5 years has been largely in part for AFENET. The flights, the room bookings, all of the other little details that make things happen because of AFENET. So we want to thank AFENET again and also recognize one of their colleagues who's been leading that.